Hello, gentlemen. Today, I've got a topic that's both fascinating and important, one that most men don't talk about until it's too late. As a physician and researcher who's met thousands of male patients over the last 20 years here in the United States, I've seen how silent infections can quietly destroy confidence, fertility, and even relationships. According to CDC data from 2025, over 68% of new STD cases in America are diagnosed more than 6 months after the actual infection, and the majority are men over 25. So I have to ask you, why do so many men walk around without realizing they're carrying a sexually transmitted disease? In the next few minutes, I'm going to show you the 5 most common STDs in men and the early scientific signs that help you detect them before they cause damage. If you care about your sexual health, hit that subscribe button right now. It costs you nothing, but for me, each click is a huge motivation. Proof that someone out there is waiting for this kind of honest medical guidance every single day. And stay with me until the end, because I'll reveal a scientifically proven secret that helps you stay ahead of these infections, boosting your immunity and confidence naturally, even if your partner has tested positive for HIV. I know talking about STDs makes many men uneasy, but here's the truth. The earlier you understand your body's signals, the faster you can protect your health and your future. Let me walk you through Jack's story, a 29-year-old who came to me anxious after one careless night, so you can spot warning signs before they snowball into something harder to fix. Jack's first visit began with a shrug and a wince. "Doc, it only stings a little when I pee. Probably the cold beers," he said. I've heard that line 1,000 times, and I knew we needed to rule out gonorrhea before anything else. He was worried. I could see it in his posture, so I walked him through exactly what we do and why. Gonorrhea is a bacterial infection caused by Neisseria gonorrhoeae. And the good news is this: when you catch it early, it's highly treatable. The bacteria favor the urethra and inflame tissues fast, which is why symptoms often show up in the lower urinary tract. Left unchecked, the infection can climb, causing complications that affect fertility, pain, and long-term sexual health. Here's what Jack noticed, and what you should watch for too. First, pain or burning with urination, especially sharp at the start of the stream. Second, a thick penile discharge that can look yellow, white, or even green. Third, itching or a raw, irritated sensation at the tip of the penis that doesn't match your usual day-to-day comfort. And here's the dangerous twist. About half of men with gonorrhea don't notice clear symptoms at all. That means the infection can spread silently until the testicles or epididymis become inflamed, leading to swelling, tenderness, and anxiety that arrives long after the opportunity for earlier, easier treatment. Silence doesn't mean safety, it only means delay. With Jack, we performed a targeted exam, a simple urine test, and a swab when appropriate. We discussed partner notification, because protecting the people you care about is part of protecting yourself. We also covered why finishing the full course of antibiotics matters, even if you feel better halfway through, so the bacteria don't linger or return stronger. If any of this sounds familiar, drop a comment 1, so I know you're listening closely and taking action. If it still isn't clear, comment 0, and I'll reply to guide you step by step. Either way, your next best move is testing and treatment, not guessing and waiting. Once Jack understood gonorrhea, he asked about those small skin changes he'd ignored for weeks. That's exactly where many men slip, overlooking early skin and tissue signals. In the next section, we'll follow Jack's story to the patterns that point toward HPV and how to see them before they see you. Several months later, Jack returned with a different worry. "Doctor, I've noticed a few tiny, skin-colored bumps near the base of my penis. Are they anything to worry about?" I nodded and said, "You're not wrong to be concerned, Jack. Let me explain what this might be and why it matters." HPV, human papillomavirus, is the most common sexually transmitted infection in the United States, spreading through direct skin-to-skin contact. It doesn't require visible lesions to transmit. Friction, close contact, and microabrasions let the virus move from one person's skin to another, even when both partners feel healthy and symptom-free. In men, HPV often shows up as genital warts, small, flesh-colored bumps that can look like soft tags or tiny cauliflower patches. Sometimes it's a single bump that hides in plain sight. Sometimes clusters appear along the shaft, at the base, or around the scrotum. Lesions can also occur in the groin folds or around the anus, especially with skin-to-skin exposure during intimacy. Here's the clinical point I told Jack. Not every HPV infection produces visible warts, and not every wart looks obvious. Many infections stay silent, kept in check by your immune system for months or years. But certain strains are linked to cancers of the mouth, throat, and penis, risks that rise when infections persist without immune control or follow-up care. The frightening truth is that more than 80% of men will acquire HPV at least once, and most will never realize it happened. That's how HPV spreads, quietly, between people who feel fine and assume everything is normal. What did we do for Jack? We examined the area, discussed treatment options for visible lesions, and focused on strengthening immune defenses, sleep, nutrition, and reducing alcohol to help the body clear the virus. We also talked about vaccination, safer skin practices, and the importance of avoiding picking or shaving over bumps, which can seed the virus to new sites. If this surprised you, comment 2. If anything here needs more detail, leave your question below and I'll clarify it. Your voice helps other men learn what to watch for and when to act. After addressing those skin changes, Jack asked about rashes and odd fevers he'd ignored earlier. Those patterns can point toward syphilis, the great imitator, so let's decode those signals before they mislead you. Jack's third visit began with the same calm voice and a worrying sentence. "Doctor, there's a small sore on my penis, but it doesn't hurt, so I figured it was nothing." I looked him in the eye and said, "I meet many young men who say exactly that. Now, I need you to really listen, because the silence is the signal. Syphilis is called the great imitator for a reason. It can resemble many other conditions and often feels harmless at first. Without timely diagnosis and treatment, it advances through stages that quietly damage systems you need for lifelong health. Stage 1. Primary syphilis. After an incubation of roughly 21 days, a firm, round sore, called a chancre, appears at the exposure site. It's usually painless, which tricks men into ignoring it. You may also notice swollen groin lymph nodes and still feel strangely fine. That is the trap. Stage 2. Secondary syphilis. Weeks to months later, you can develop a distinctive rash, reddish-brown spots on the palms and soles that aren't itchy. You might feel fatigue, low-grade fevers, headaches, lymph node swelling, achy muscles, and patchy hair loss. Because these signs come and go, many mislabel them as stress or a random virus. Latent syphilis is the quiet middle ground. The infection goes underground. No obvious symptoms, but it hasn't gone away. Without testing, you can carry it for years, pass it to partners, and set the stage for more serious harm later on. Tertiary syphilis is the final and most dangerous phase. It can strike the heart and major blood vessels, the brain and spinal cord, the eyes, the liver, and the bones, leaving disability that medicine can only partially reverse. This isn't drama. It's the natural end of an infection allowed to run. Syphilis can make a strong man appear outwardly normal while his inner systems slowly erode. The body keeps functioning, until one day it. That hidden countdown is why early testing is an act of strength, not fear. What did we do for Jack? We examined the lesion, tested for syphilis and other STIs, and started evidence-based treatment. We discussed partner notification and why finishing therapy matters. We paused intimacy until medically cleared and set reminders for follow-up testing to confirm cure. Here's my message to you. If you notice an unexplained sore, a palm sole rash, or fatigue that doesn't add up, press pause on denial. Get tested. Syphilis is curable with antibiotics when caught early, and the sooner you act, the less chance it has to leave a mark you'll carry for years. If you've ever seen a strange, non-itchy rash on your hands, comment 3. If this topic spiked your anxiety, breathe. Drop a question and I'll help you today. Calmly, clearly, step by step. Jack, now fully engaged, asked about infections that hide without obvious sores, subtle urinary changes, and a slow drain on energy. That's where many men meet chlamydia, the quietest troublemaker of all. Let's bring it into the light. After treating syphilis, Jack wasn't quite the same. His confidence had faded, replaced by a quiet worry that every man eventually understands. One afternoon, he asked with a hint of hope in his voice, "Doctor, is there another disease I might have without realizing it?" I nodded and replied, "Yes, Jack, there is. It's called chlamydia, the invisible one." I could tell he was listening more carefully this time. Chlamydia is the most common bacterial sexually transmitted infection in the United States, and what makes it so dangerous is its silence. Over 60% of men who contract it have no symptoms at all. It hides in the urethra, slowly irritating tissues while giving the illusion that nothing is wrong. When symptoms do appear, they're subtle, easy to dismiss as something ordinary. You might feel a mild burning when urinating, notice a slight discharge, or experience itching at the tip of the penis that comes and goes. In rare cases, testicular pain or a dull ache in the groin shows up. But the truth is, most men never reach that stage. They continue living unaware that a small infection is quietly spreading inside. Scientifically, chlamydia is caused by the bacterium Chlamydia trachomatis. Left untreated, it can cause epididymitis, an inflammation that leads to pain, swelling, and eventually reduced fertility. It can also open the door for other STIs, including HIV, by weakening local immune defenses. So, while it may seem minor, the long-term impact can change a man's reproductive future. You could carry chlamydia for years without knowing, until one day it steals your ability to have children. That's why early detection isn't just smart, it's an act of self-respect. When Jack heard that, he sat back quietly and said, "So it's not just about symptoms, it's about timing." I nodded. Exactly. The earlier you act, the easier it is to stay in control of your health, your future, and your peace of mind. If you believe knowledge can save a life, comment 4. And if something here hits close to home, don't panic. Just listen carefully to what comes next. Youth only comes once, and your choices today protect the years still ahead. As Jack's story continued, I noticed something shifting. His questions became sharper, his tone more serious. That's when we reached the final lesson, herpes, the one infection that never fully leaves once it enters your body. Jack returned once more, a little quieter than before. "Doctor, this time I'm seeing small blisters in my groin," he said. "They sting a bit." I took a breath and answered honestly, "Jack, that sounds like genital herpes. I don't judge you, and you don't need shame. I only wish this message reached you earlier. Herpes is caused by the herpes simplex virus, HSV. Most often HSV2, sometimes HSV1. There is no complete cure, and the virus can be managed, outbreaks can be shortened, and transmission can be reduced, but HSV establishes a lifelong presence in the body once it arrives. Primary episode. Symptoms often appear about 4 days after exposure. You may notice clusters of fluid-filled blisters that rupture and form shallow ulcers, along with tender lymph nodes, fever, fatigue, and a raw or burning sensation. For many men, the first outbreak is the roughest. Recurrent episodes. Over time, the immune system learns. Outbreaks usually become shorter and milder. Some men feel tingling, itching, or a light burn for a day before lesions appear. Others have symptoms so faint they miss them. Even when you feel well, reactivation can happen silently. Science in plain English. HSV travels along sensory nerves and settles in nerve ganglia, where it lies dormant between episodes. Stress, illness, friction, or sleep debt can wake it. This neuroskin loop explains why outbreaks repeat in the same area, and why good sleep, nutrition, and stress control genuinely help. Here's what most people don't realize. Transmission can occur even without visible sores. That's called asymptomatic viral shedding. It's the reason honest conversations, barrier protection, and informed timing matter just as much as treatment. What did we do for Jack? We confirmed the diagnosis, discussed antiviral options, and built a practical plan. Start medication at the first tingle, keep a small supply on hand, and use condoms plus lubrication to lower skin friction. We also covered disclosure, because trust grows when partners share accurate information at the right time. If this reframed how you think about sexual health, comment 5. Remember, strength isn't pretending you're invincible. It's learning fast and acting early. If anything feels unclear, drop a question and I'll guide you calmly, step by step. After 5 infections in one masterclass, you might be wondering, how do I stay ahead, not just react? Good. In the next part, I'll share the evidence-based routine I give my patients, a simple plan that builds immunity, reduces risk, and restores confidence. If you're still here, I'm genuinely grateful. Only about 10% of viewers stick with men's sexual health videos to the very end, and you chose to stay. That tells me you value clarity, courage, and the kind of knowledge that keeps families strong and futures open. If this helped you even a little, drop a single dot in the comments or share a brief story. I read every message. Your voice not only guides this channel, it helps another man somewhere feel less alone and more prepared to act early instead of waiting. Now, let's turn attention into action. In the next section, I'll show you how to spot early patterns with confidence, prevent the common mistakes that spread risk, and build natural immune strength so your body stays one step ahead. See early, sense changes, scan on time. That's how we protect health without fear. Here's exactly how I helped Jack rebuild control, and how you can do the same. We use the simple 3S framework: see, sense, scan. It turns confusion into a checklist so you act early without panic or guesswork. See the small changes. Watch color, texture, and odor shifts in skin and discharge. Notice burning at the start of urination, unusual drips in the morning, or irritation after friction. Track these notes on your phone once a day for 7 days. Patterns beat random memories. Sense what your body is saying. Check for low energy after sex, night sweats, low-grade fevers, persistent itching, or recurrent redness. If 2 signals cluster, say fatigue plus a new rash, slow down, hydrate, and avoid intimacy until you understand the cause. Listening buys you time and prevents spread. Scan on a schedule. Test every 6 months or sooner after a risk event. Order a combined panel when possible: HIV, syphilis, chlamydia, gonorrhea, and consider trichomonas or hepatitis tests if relevant. Confirm cures with follow-up testing. Results, not feelings, close the loop. Most men stumble on the same 5 mistakes. Write these down and dodge them. Mistake 1. Self-treating. Antibiotics without testing hide problems and drive resistance. Mistake 2. Hiding from partners. Honest conversations are uncomfortable, but secrecy spreads infections faster than any symptom. Mistake 3. Skipping routine screening. You can't manage what you never measure. Mistake 4. Reusing leftover meds. Wrong drug, wrong dose, wrong duration. Old pills create new issues. Mistake 5. Waiting for obvious symptoms. Silence is common, delay is costly. Make the appointment. As promised, here's the Immune Boost protocol. I teach patients to stay a step ahead, especially during recovery. It's practical, measurable, and fits real life. Step 1. Sleep. 7 hours every night. Your immune system resets in deep sleep. Protect a consistent bedtime and keep screens out of your bedroom. Step 2. Support natural testosterone with food. Base meals on lean protein, vegetables, olive oil, nuts, and whole grains. Limit binge alcohol and ultra-processed snacks that inflame tissues and worsen recovery. Step 3. Supplement wisely. Vitamin D and zinc, as advised by your clinician. These support mucosal defenses and may shorten recovery when paired with treatment and rest. Use evidence-based doses. More is not better. Early data from U.S. 2025 clinical reviews suggest that men who follow this 3-step protocol consistently see lower recurrence and fewer complications. About a 42% reduction in reinfection risk compared with inconsistent habits. Think of it as building armor you wear daily, not a pill you take occasionally. If you're ready to start now, comment, "I'll do it." If something needs clarity, write your question. I'll jump in and help the same day. Your action today protects your health, your partner, and your peace of mind. Take a breath. In the conclusion, I'll recap the 5 infections, the 3S framework, the 5 mistakes to avoid, and the immune protocol, so you leave with a clear plan you can follow tomorrow morning. Thank you for staying with me. If anything today didn't meet your expectations, drop a comment below so I can help directly. Now, let's recap the essentials so you leave with a plan you can act on tomorrow morning. 5 STDs every man should recognize: gonorrhea, HPV, syphilis, chlamydia, and genital herpes. Each can look minor at first, but early awareness prevents long recoveries, protects partners, and keeps your confidence intact. Remember Jack's story. Small signals, big consequences when ignored. 3 golden tools. See. Sense. Scan. See the small changes in skin, discharge, or urination. Sense patterns in energy, fever, itching, or recurring redness. Scan on schedule with combined testing, because results, not guesses, are what close the loop and restore calm. The secret we promised: the Immune Boost Protocol. Sleep at least 7 hours. Support natural testosterone with real food. Use vitamin D and zinc wisely under clinical guidance. Together, these habits build everyday armor and reduce the chance of reinfection while treatment does its job. Your next steps are simple. Choose one habit to start tonight, schedule your screening, and share what you learned with someone you trust. If you want a step-by-step tutorial for home STD testing, comment 9. And if this helped, subscribe so we can keep building a community of men who prevent problems instead of waiting for fear. I'm Dr. Jame, your physician and your friend. I believe real health doesn't begin with pills. It begins with knowledge, presence, and action. Take care of yourself, and I'll see you in the next lesson.